Dr. Vijaybhasker, Chairman, Ethics Committee, Clinical Research and Trials. Today we will discuss about the sciatica. Sciatica is the nerve pain which is the thickest nerve in the body, which is the form of nerves from the back. Multiple nerves lead to a thick cord nerve into the gluteal region down to the leg. This nerve is the form of lumbar nerves and sacral nerves. When this group of nerves comes out of the neural foramina in the vertebral column, so you can see this is the sciatic nerve. This nerve is the form of multiple nerves coming out of the neural phenomena of each vertebral body. There will be one nerve coming out from right and one nerve coming out from left. So these nerves form together become sciatic nerve. When there is a irritation of the sciatic nerve and a dragging pain from the back to the down to the limbs in the posterior aspect of the leg, that is called sciatica. So obviously there are certain other causes. The main cause for the sciatica is, you can see these are the vertebral bodies and there is a disc in between the vertebral body. This disc acts like a shock absorber between the two vertebral bones. This disc has a annular ring around the disc and there is a centrally located fluid or jelly-like fluid. So it acts like a shock absorber whenever jump, bend forward or back. So there is a possibility of certain trauma or certain other causes leads to damage to the annular ring of the disc. It's like a puncturing or burst out of the oil seal for the shock absorber. So when there is a burst out of the annular ring of the disc, there is a jelly-like fluid comes out and puts the pressure on the nerve root, whichever side is affected. It could be right side or it could be left side or it could be centrally put the pressure on the cord, that is spinal cord. So the sciatica pain leads to pain posteriorly to your leg, buttock region, and which side is there is a cause. So obviously the sciatic pressure caused by a disc is most important. Certain times we do a laser discectomy, microdiscectomy, open laminectomy and discectomy to reduce the pressure of the disc on the sciatic or the roots which is leading to sciatica. So earlier, when there is an initial sign of sciatica, we can conservatively treat with the belt at the back, caring, physiotherapy, medications might help or to relieve the pain, preferably bed rest. Apart from the pain is not relieved for even 6 weeks, 6 months, the pain is increasing and there is a neurological weakness in the limb. That means the biomechanical pressure on the root is high. Hence we should do a MRI, rule out the cause for the pain and then treat accordingly. What exactly I said about the 4 surgeries. So my dear friends, sciatica is the root pain causing from the back to buttock to lower limb, which is very irritable, very painful, and sometimes lead to weakness in the limbs, which might lead to paralysis. Hence, my dear friends, take care about the sciatica, undergo, meet the orthopedic surgeon or the neurosurgeon, undergo basic X-ray, CT scan, MRI, whatever necessary, few blood tests, rule out other comorbid conditions, and then need to undergo, whether it's a medical treatment, physiotherapy, bed rest, and if necessary, surgery. Thank you.